heart and to talk about the products. Maybe if I can ask you if you have any expectation through this session, if I just ask you, do you expect something out of this session? What would be your answer? What do you want to know through the session? What do you want to know? I said heart. Okay. You want to get confident to speak. Very nice. Minimum, yes. You will get that. What more? We will get new information. Yes, thank you. You will get new information. I'll give a set of information, whether that is new or not, I don't know. Fresh information, I don't know what is old information to give you fresh information. So I'll give a set of information, whether it is fresh or not, you have to tell me. Problems and solutions, yes, of course, there are some problems in the heart, and what are the solutions? Yes. How can we reduce the heart challenge in the population? Amazing thought, ma'am. Yes, that's the whole objection. That's the whole objection. How to maintain a good heart for a long time? Awesome. Great expectations from everyone, and I'm very, very confident. I can assure you that this session will give answer for all. Okay. Yeah. Now, a very typical scenario, somebody is overweight or even obese, very obese, say about 120, 110 kgs, which is quite normal these days. People are there of that weight. That's why I didn't say obese, I said very obese. So that kind of a person. And you know for sure that the person will have a heart problem. You know for sure. Fine. How will you go and even tell the person, my dear friend, you will have a heart problem because I could see that you have overweight, and it's better that you take heart care products, or are you doing something for your heart? Can you go and even ask them? No. What will he say? Take care of your business. I know what to do. Fine. And we are into that business. Our product revolves around that. So how do we then manage this situation? So for that, we have identified that there are some amazing, interesting facts about heart, and you can start your conversation through this. These can be your conversation starters. Okay. Say example, if you meet a lady, a woman, okay, and to her, we can anytime ask, do you know that your heart beats slightly faster than your brother's heart or your husband's heart or your father's heart? Who are they all? Men. Fine. So she will be like, oh, is that so? I didn't know this information. And then you can start to talk about your heart. A very easy question, my dear friends. Do you know where the heart is? The moment I say heart, some people would take their left, some people would, feel their right, and very rarely people go to the middle. Actually, it is in the middle, but slightly tilted. Slightly tilted, but otherwise it's in the middle. Many people do not know this information. So when a typical heart pain occurs, it starts from the center only and then radiates. People most of the time think that the heart is somewhere in the right or left, and that is why they think, okay, this could be a gastric problem, and leave it. Fine. Yeah. There are many issues in the heart that can happen. This is a muscle, a very hard working muscle as such, a muscle that is very loyal to us and gives a lot of respect to us. Only when this muscle works, we are called names. The moment this muscle stops, there's nothing. And it is hard working, that it keeps, filling our body with blood, like pumping machine. It just keeps pumping. And there's nothing better that it does, or nothing beyond that it does. So many people think that it also filters the blood. It gives oxygen blood to the other parts of the body. Nothing. It only pumps. Whatever comes, it pumps and sends. like how your motor behaves at home, exactly the same way. It only pumps, but pumps at least 5 liters of blood in 1 minute time, approximately. In a minute's time, it pumps about 5 liters of blood. And if you take, for example, in a day how much it pumps, and if you calculate in a year how much it pumps, and on an average a person lives up for about 70 years of age, average I'm saying. So for 70 years of age, how much it would have pumped? It goes in crores liters, 2 crores, 26 crores liters, sorry. And you can fill that, for in a water tank that can supply water to the areas nearby. So that kind of a job it does. Will it have problem? Yes, it's a muscle, so it will have problem. It cannot go without problem. It will also have problem. Are all problems major problems for heart? Not necessarily. There are some minor problems also for the heart. But since the organ itself is a little complicated, we always think that anything that happens to the heart is going to lead to some bigger issues. So it's always better to take care. And if all other organs stops working, your liver stops working, your lungs stop working, why that? Your brain stops working also. People say that you are in coma and still, keep us somewhere. The moment this organ stops, we don't have place at all. Everybody knows that, not even the hospital. And we know where the place is. Fine. So that is why this organ has to be taken care of. It has to be given its due importance, due respect. So few things to talk good about heart before I get into the diseases that heart can have. The heart size is about 2 hands clasped together. Join your hands. Whatever the size you get, that's the size of the heart. There's nothing called bigger heart, smaller heart. This is the size of the heart. Blue whales have the largest heart of any mammal. The size of the heart is huge in a blue whale. Apart from that, almost all the mammals have the same size of heart. Very rare scenario in heart is heart cancer, because the multiplication of cells, division of cells in the heart doesn't occur. It's a very rare kind of cell that the heart is made up of. So there is nothing called division of cells. So it doesn't grow or it doesn't shrink. It is the same size till we go. Fine. So these are the facts about heart. Interesting facts, right? Interesting facts, right? Do you know any other facts? Abraham said, yes, it stays in between the lungs. Amazing. It's in the center. Super. Any other information about heart that I don't know? Somebody want to share? Let us make it little interesting, so that I'll also know how many of you are, watching, sitting and watching, attending the session. Thank you, Abraham sir. He says the heart is placed in the center of the lungs. Yes. Super. We will keep, doing that now and then. We will see if anybody could get any information. Please pass on. Yeah. Now coming on to the importance of heart. Heart is a muscular organ. We all know it's a muscular organ, and it pumps blood continuously. It pumps blood continuously. Okay. And yes, it works without taking rest. Yes, it works without taking rest. And Ninan said the size of the fist is, like 2 fists joined together. Not only the size of the fist, 2 fists joined together. Clasp of the hands. So that's the size, Ninan said. Fine. Yeah. It's a muscular organ and pumps blood continuously throughout the body. The blood goes continuously throughout the body. So heart is a very important pump. And there are a few more facts about the heart. 85% and whatever problem that occurs to the heart is called cardiovascular problem. Okay. Heart is, in other terms, medical terms, is called as cardio. Vascular is the blood capillaries and the vessels that carry blood to them. So the cardiovascular problem. So 85% of all cardiovascular disease death are due to heart attack and stroke. 85% of them. So if you see, what does that mean? There's no challenge with the muscle. The challenge is with the vessel that carries blood to the heart. Fine. More than half of the total cardiovascular disease death in India in 2016 were people who were younger than 70 years of age. In 2016. But during COVID 2020, okay, many people whom you have seen who have died because of COVID or non-COVID, you might have seen most of them have died because of heart attack. That's a different, how does the heart attack occur during COVID is a different topic altogether, which I will cover on some other day. But the problem here is they were as less as 50 years of age, not even 70 years. Not even 70, they were as less as 50 years of age. And 1.13 billion is estimated people worldwide have hypertension. Okay. Most of them are living in low and middle income countries. So there are many people who live with hypertension, which is the major reason for heart attack. Okay. Yeah. Now, how do I test for a heart attack? Does my body indicate that you will get a heart attack in future? How do I know that I'll get heart attack? Or who all are prone to heart attack? Who all might get heart attack? Any possibilities that you know? Anything that you have heard? Anything that you have heard? How will you even go and tell people, ma'am, because of this problem, you will have heart attack in future? How will you tell them? What is the problem? Okay, let me tell you, my dear friends. Let me tell you. As such, heart attack doesn't come straight away. Okay, nobody is born with a heart attack. Don't worry. Or heart disease. Very rarely those diseases are like, rare diseases. There are some birth defects. I don't say no, but rarely. Otherwise, this is more of a lifestyle disorder. What do we mean by lifestyle disorder? It means that as we grow older and older and older, there are certain things that we are not supposed to do in life because of altered lifestyle. This has come. What are the alterations that has happened in life? One is the food. Do you agree with me or not? Has the food changed or not? Yes, food has changed. Second very important thing is the exercise pattern. You don't see many people going for exercise. You don't see these days. Third one is mental health is very less these days, very low. People have low mental health. They don't have great mental health. Fine. So these challenges keep building up, piling up in a body, and at the end, it doesn't know how to show off, and that is shown off with a heart attack. I get some interesting answers here. Asha ma'am says obese people, high BP, diabetic, and people with triglycerides. Awesome, ma'am. You have all the capabilities to become a consultant for heart issues. So you can build on that and reach out to your customers. Asha ma'am. Abraham sir, weak muscle, amazing. Amazing. When the muscle becomes weak, heart muscle becomes weak, then also heart attack occurs. Awesome. High cholesterol level, Ajay Philip. Yes, high cholesterol level. Mini Vinod also says high cholesterol level. Panikar sir says obesity. Yes, many people do not know obesity leads to heart attack. They think, okay, it's somewhere in the body that I'm growing. Why should heart be affected? Just think for a moment. Body becomes big and heart is still small. It will not grow. As a body grows, heart will not grow. It is the same size. Will that pump be sufficient to supply blood everywhere to the body? If your tank is so big and you have half HP motor, is that sufficient to give that water to fill the tank? Not sufficient, right? As good as that. So for your body to be, shrink to a certain limit, this pump is sufficient for you to give the blood. So that way, all your answers are right. Amazing answers. Thank you so much for this wonderful, lovely answers. And yes, as Asha ma'am rightly said, the first indicator is blood pressure. What is blood pressure? It is the pressure of circulating blood on the walls of the blood vessels. When the walls of the blood vessels hit, when the blood circulates, it's called blood pressure. And blood pressure has a measure. It's not, just because I don't like somebody, I say they have pressure, or somebody shouting at me, I say, what, you have pressure or what? No. There is an indicator. There are numbers. It is measured in terms of systolic and diastolic. Systolic is, what is systolic, diastolic? The heart muscle expands and contrasts, okay? That's systolic and diastolic. It's the system is called systolic and diastolic. So in any given condition, when it expands, it should not go under, it should be under 120, should not go beyond 120. Diastolic, when it controls, it cannot be less than 80. At least it should be till 80. So this is the normal number. And this normal is normal only for very few people. Because today we all are with stress. Okay. So with the stress in the body, hypertension starts. Okay. What is hypertension? Hypertension is when somebody is always tensed and the heart muscle is also tensed. Fine. That's because of the stress that we have. So before that stage is called pre-hypertension. It's not typically hypertension, but pre-hypertension, where systolic is between 120 to 139 and diastolic is between 80 to 89. The moment the systolic touches 140, we call that person as hypertension party. 140, hypertension party. Okay, you can't control that. And diastolic is between 80 to 89. That's stage 1 of hypertension. That's still manageable. Okay. Stage 2 of hypertension is above 160, and stage 3, which is very critical, which is crisis, is above 180. 180. And diastolic is above 110. And for some people, if you see, my dear friends, systolic, diastolic need not be, the same. Like what I mean to say is, if systolic is high, diastolic also need not be high. For some people, systolic is high and diastolic is normal, or diastolic is high, systolic is normal, or both are high. In any given condition, it is called as high blood pressure. Okay, this is a first indicator. So when you go and talk to your customers about heart health, or if they ask, do you have something for heart I want to take? And, you need not even ask them, are you a heart patient? And if they talk science, we may not understand. If they say some, cardio language, we will not understand. So the first thing you can ask is, how is your blood pressure level? And with that indication, you will know whether they are heart people or not. Yeah. Okay. The second indicator is cholesterol. What is cholesterol? It's a waxy substance found in your blood. It's a very waxy substance. Your body needs cholesterol to build healthy cells, but high level of cholesterol can increase the risk of heart disease. So with high cholesterol, you can develop fatty deposits in the blood vessels. With high cholesterol, you can have fatty deposits in the blood vessels. So the blood vessel is like this. But as we grow older and older, there are deposits. Can somebody tell me from what age this deposit happens? From what age can it happen? Okay. Awesome. There are people who have given answers. Alexander says 35 and Minnie says 40. Abraham says at any time. Shalby says 30. Sri Kumar says 50. There's no limit. 30 plus. Okay. For all of you who say 30 plus, 30, 40, all that, I am going to give you a shock. Be prepared. I'm going to give you a shock. And thank you so much, Narayani ma'am, for giving the right answer. It starts from 2 years on in the first decade of your life. Asha ma'am also says 5 years, which means first decade. First decade is less than 10 years. It starts from 2 years on and can go up to any number of years. Fine. Oh my goodness. From 2 years, if it starts building up, now I'm 45, 48. Now, how much buildup would have happened? Will the blood have place to go? This will be the question. Don't worry. Every day the fatty deposits occurs. Some good food go to the body and slowly remove the fatty deposits. Say every day there is a plaque formation in your teeth. You can feel, you put your tongue inside, you can feel the soft layer on the teeth. The next morning when you brush or night before going to bed, if you brush, it goes off. It's clean and fresh. Likewise, this vessel also get cleaned with good food, get deposited more with bad food. And it is in your hands. Now you understand. It is in your hands. Nobody would do that. It's in your hands. Eat good food, it cleans up. Eat fried food, it builds up. Which one you want, you decide. That's cholesterol, but a very important indicator. Third indicator is diabetes. Though it is not directly related to heart disease, but there is a myth. There is a proof also, not only myth, there is a proof also that somebody with diabetes, what is diabetes? High sugar level, also can have heart attack in future. Okay. Why? Because these blood vessels which carry blood to the heart, they get affected because of diabetes. Somebody with diabetes, their valves get affected. So once the valves get affected, there is a possibility that, the person can have heart problems. So have a check on your diabetic level also, sugar level also. Okay. So what could be the number? I will let you know. I will let you know on that numbers. Right? Yeah. So these are the key 3 indicators. There is one more indicator. There is one more very big indicator, and that indicator will have any of these. It is not alone. It is not alone. It is with any of these. Can somebody guess? The person with that indicator will either be high tension or blood pressure person, or will be with diabetic, or will be with high cholesterol. Can you guess what that could be? Awesome. Thank you. Again, Narayanima. Obesity. Super. So, obesity. What is obesity? Obesity is if our body weight is beyond normal. There is a ideal body weight that for how do I calculate for the height that I am in? For the height that I am in, I'm supposed to be with certain kgs. That's nature. Okay. Say example, if you have to calculate that properly, if I am 157 centimeters, reduce 100 from that straight away. Why? What? Don't even ask. Just 100 straight away. Whatever you get is your ideal weight. You are supposed to be 57 kgs. How much we are? Sometimes could be 62, sometimes could be 64, sometimes could be even 84, 85. If we are up to 10% more, up to 10% more, we are said to be overweight. The moment we exceed 10%, it is said to be obese. It exceeds 30%, it is said to be over obese or extremely obese. With this, yeah. So this obesity is one of the biggest indicator. It's not indicator, it's for sure. That's why we didn't put it as an indicator. It's for sure that the person will have heart attack. So it's always better to, get back to normal. Heart attacks are usually acute events. What is acute event? It's not chronic, which means nobody, will be bedridden because of heart attack for months together. So that's chronic. Acute is you get for some time, and after that it's either do or die. You either take a treatment and come out of it, or nothing happens. We can't do much. Okay, that's called acute. So heart attacks are usually acute event and are mainly caused by blockage that prevents blood from flowing into the heart or the brain. And the most common reason is the buildup of fatty deposits in the inner wall of blood vessels. So we have to take care of inner walls of blood vessels. So our food habit has to be changed so that the inner fatty deposits doesn't happen. Now, how do I know that the person has a heart attack? This is a very critical question. There's always a conflict between the brain and the body. Always a conflict. Body indicates that there will be a heart attack, but brain cannot accept. Okay, brain will think, because we are so scared of it, so we don't want. For a moment, I'm sure nobody want to even think that I'll get a heart attack. Nobody want to think. Forget about getting. Okay, so we in that process we miss out on the indications. We miss out on the indications. And it is said, even for heart attack, there is something called golden hour or golden time. Golden time. Okay, even if it is very acute, massive, you get 4 minutes time. 4 minutes time. If it is moderate, you get 20 minutes time. And if it is mild, you get 1 to 4 hours time. It is possible to save the person. But only thing is, at that point in time, our brain will tell something and heart will not accept it. Okay, there is a conflict. So how do I know whether it is a heart attack? Okay, touch wood, nobody will get this symptom. So don't wait for the symptoms. I'll pray, including myself, that we should not get the symptom in our life. Otherwise, you see people I've seen in movies or somewhere, shortness of breath. They keep breathing, gasping for breath. It's a big breath. You can't even imagine, that kind of shortness of breath. Mild pain or discomfort in the center of the chest. See, the pain area is this. Don't wait for the right or left. It's in the center, but slightly tilted towards the right. Slightly tilted. Okay. So it is in this area that the pain occurs, and the pain slowly radiates to the arm, back, neck, jaw, and stomach. It radiates to that area. And the very good indicator is severe pain in the armpit. The armpit area, if there is severe pain. And, don't even think whether it will radiate in the left side or right side. We never know. It's in the center, so it can take any direction. Both the routes lead. So which direction you want to go? So we don't know. But it is usually said, the right armpit pain is a biggest indicator of heart attack, whereas the left side could also be because of gastric problem. Fine. But don't look into all that. So cold sweat and sweating is not the word. It's like water oozing out from the body. Nausea, feel like vomiting. Many people vomit also. And lightheadedness, very drowsy and as if the entire room is revolving. So that is the kind of, symptoms that people get for heart attack. And it all depends on how mild it is, how moderate it is, how severe it is. Fine. Yeah. Who are at a greater risk? Now that you said, this is the symptom for heart attack, who all will be at greater risk? Somebody who uses tobacco on a daily. regular basis. Somebody who chews tobacco or tobacco in the form of cigarette, BD, so all of them are at a risk. Unhealthy diet and obesity. And for your information, my dear friends, this was the first reason few years before. Now this has taken the second place and this has become the first reason. Unhealthy diet and obesity. This is the first reason. Long time before, this was the first reason. People who chew tobacco will get heart attack. Now that's become the second reason. The first reason is unhealthy diet and obesity and physical inactivity. Somebody who do not, go on physical inactivity, alcohol consumption. Somebody who consume alcohol on a regular basis, hypertension and diabetes. These are the big indicators of risk. These are the reasons for risk. Right? Yeah. How do I take care of my heart? Can I take care of my heart? My dear friends, it's a very friendly organ. The more care you take, it resonates so well. It understands that you are taking care and it reciprocates again. It gives back to you. Like I was telling about, liver yesterday. So it's a nice organ. So don't worry. So prefer homemade food against any fast food. Fast food is still fine, but once in a while, don't make it as a practice, particularly for children. Avoid junk food as they are major cause of obesity, particularly the packed food like chips, like chocolates, all that has to be avoided. It is preferred to have fruits and raw vegetables instead of munching on snacks. If you feel like having snacks, avoid snacks and try to have in the form of vegetables, like vegetable salad or fruit salad can be a good choice. Limit consumption of sugar and unhealthy processed food. Keep your salt intake less than 5 grams and avoid dry fish, pickles. I know Kerala, when pickles are available in non-veg also. Non-veg pickles like prawn pickle and all is available. Dry fish is so very famous. So try to avoid that. Once in a while it's okay, but try to avoid that. And salt should not exceed 5 grams a day. One piece of pickle has 5 grams of salt. So if you're taking pickle on that particular day, ensure that you're taking only curd rice without salt. So like that, you have to manage and adjust. Avoid trans fat. What is trans fat? Fat cannot be seen outside. If somebody touches, they don't get the feel of fat in their hands. But there's a lot of fat inside. That's called trans fat. All example is your puffs, bakery items, puffs, cakes, and cookies. All that when you see, you don't see oil. Like you see your bhaji bonda, you don't see oil. Padam bhaji and all, you see it's so much of oil. Oil drips from padam bhaji. But that's still better. That is still better. When you go to a bakery and buy a egg puff or veg puff and put it on a tissue paper for 5 minutes and then take, you see a lot of oil getting absorbed in the tissue paper. That's bad. That's called trans fat. Fine. So serve yourself small portion of high calorie food and large portion of healthy food. When you serve food, your plate should have maximum of healthy food and very little of fried food and sugar food. Fine. Yeah. So is food only sufficient? Also very, very important. Oil plays a very major role in your heart health, my dear friends. So what oil to take? There are so many types of oil available these days. Cold press oils are available, and Kerala is still better because many of you use coconut oil till today. And there's again a lot of discussion around it. Some people say coconut oil lead to heart attack. Some people say coconut oil is good for heart attack. There's different school of thoughts. What all I know about oil is, do not use the same kind of oil on a regular basis. Give it a rotation. What does it mean by rotation? 1 month, one oil, other month, another oil. That would be better. Or some dishes in some oil, other dishes in different oil. So that was a practice, I still remember at home. Today we get in pouches. But otherwise, when we were not getting in pouches, all the oil, like gingerly oil and, your groundnut oil and coconut oil, ghee, butter, all this will be used at home for different dishes. Whenever we prepare different dishes, different oil goes in. So that kind of oil rotation is important. And these days we have choice of oil also, like vegetable oil is there, rice bran oil is there. So there are so many different oils that have come. So try to keep changing oil. No oil is good, no oil is bad. Okay, no oil is, don't believe if the pouch says 0 cholesterol in that. Don't believe in that. And don't go behind, repeated one oil. Somebody says, I use cold press chicken and I give you that. Why not you buy? Don't just believe that. Your body should not get used to one kind of oil. So that is where the pattern of, the fatty deposit happens. The pattern should change. 1 month, if there's more fatty deposits, that's okay. The next month, fatty deposits will corrode, that's okay. So it should be that way. I hope you understand what I'm saying. So that is about food. The second thing, oil, salt, sugar. If this is controlled, your heart risk would get controlled by 50%. And I mean it. I've seen it. These are the 3 major culprits. Fine. Yeah. Second very important thing is being physically active. Being physically active. Do not go for any only cardio exercises to start with. Not required. First, warm up your body is very important. When you start doing something for your heart, any good exercise is good for heart also. Even walking for that matter. There's nothing better than walking for heart. Okay. So if you see, walking doesn't help in reducing your weight. Only jogging or running will support. But why do we walk? To increase your heart rate, okay, and pump the blood faster to all the parts of the body. So that way, don't do intense exercise for the heart. It damages your heart. Go with low intensity and then increase the intensity and see how it can be done. And if you are in the weight management program, better take some advice for your heart health exercises from a trained person, from coach or someone, mentor. Drink water before, during, and after the workout session. Hydrate your body. Most of the time, dehydration during exercise leads to heart attack. So muscle becomes very weak and it cannot pump, and that's why drink good amount of water. Wear appropriate clothes while you do the activity. Good amount of air circulation should be there when you exercise. And if you have any specific health conditions, discuss that with your physical healthcare provider so that the exercise can be changed or altered. Fine. Yeah. So to take care of a good heart, we should know where we stand and then we should improve. Okay. So how do I know where I stand? You should know your sugar level, you should know your pressure level, you should know your body weight and cholesterol. These are the 4 things that you should know. Have it ready. Okay, which you can do even now. If you don't know, I'm sure everyone should be knowing, but if you don't know, there's nothing wrong and get this tested every year, at least every 6 months. Once you cross 45 years of age, till then, it is at least once in every year that we have to get these numbers checked. So when talking about your diabetic or blood sugar level, before eating, during fasting, it should be less than 100. And 2 hours after eating, it cannot go beyond 140. It should be less than 140. That should be your number. Now see where you stand. Okay. So blood pressure 120 by 80 is awesome. That's the number that you should aim for. And rare scenario 140 by 90. As we grow older and older, you cannot expect this 120 by 80. So ensure at least that it does not exceed 140 by 90. You should not even get into hypertension level at all. So maintaining by 139 is awesome. Not even getting into 140. Blood cholesterol, there are 3 different variations in this that you have to know. You should know your triglycerides. It's a type of fat. Triglyceride should be less than 120. And your LDL, low density lipoprotein, your HDL should be above 55. Earlier it was 45. Now doctors say it should be above 55, and more so for women. That's called good fat. HDL, high density lipoprotein, is good fat. So that should be above 55, and your total cholesterol should be less than 200. It cannot, or it should not touch 200. It should be less than 200. And at any given point in time, your body weight, which is measured in terms of BMI, body mass index, should not exceed 24.9. Okay. And it should not come down from 19 also. It should not go less than 19. So it should be between 18.6 to 24.9. Fine. So this is how your numbers can be. If you see these numbers in your report, be happy, give a pat on your back, and continue with your foundation range. Continue with your foundation range. That's more than sufficient to keep you healthy. What is the foundation range? PDO, add calcium to it. C, that's more than sufficient. Protein, daily, omega-3 and calcium, more than sufficient. But if you see some variation in somewhere, I'm going to help you to understand what all supplements that I should take. And this is a lifestyle disorder, my dear friends. Once it goes beyond our control, then medication comes into the picture. You have to get medically treated. But as long as it is within the limits, you can very well take care of your heart only with supplementation. And we all know supplements are not medicines. They are, to alter our lifestyle. They are a food to alter our lifestyle. So you can manage with supplementation and take care of it. Fine? Yeah. So till now, any question on the concept? Any question? Yes, Panikar sir, junk food also causes heart problem. Lack of omega-3, yes, it causes heart problem. Any questions till now before I get into product? I'm going to talk about product now. No questions. Fine. Is it interesting at least? Is it interesting at least? Are you with me? No answer for that also? Okay. Yes. Thank you. Thank you so much. Yes. So we all know what to eat, what not to eat. But most of the time, it becomes very difficult to manage our diet. Very, very difficult. Thank you so much. Thank you. I got it. Thank you. So most of us cannot follow, the regimen. And that too, coming days are going to be all festivities. There'll be a lot of sweets at home, a lot of people coming in, fried food. Onam is coming next month. Okay, waiting for Onam Shraddha. So there are so many, things that are happening, and we cannot miss out. And the purpose of life is to enjoy all that. Fine. So now, if I have to keep my heart healthy, do we have any supplements? My dear friends, one thing if I have to tell you, Nutrilites, all the products, any product you take has one or the other benefit, direct or indirect benefit to the heart. Any product you take for that matter, it has one or the other direct or indirect benefit to the heart. Okay. So we are not going to talk about the indirect benefits here. We will straight away talk about the direct benefit. And I'm going to consider you as a solution provider so that you don't beat around the bush to your customers and give them straight products. Recommend the straight products with, of course, PDOC is important. I never said PDOC is not important. PDOC is important. But if they say, if your customer is aware and they know, my heart problem is because of triglyceride level. My heart problem is because of cholesterol level. I have a heart problem because I'm diabetic in nature. And if they, come out with a problem, then you have a better solution in your hand and you can talk about it and save them from a big, massive attack. Fine? Yeah. So I'm not going to go deep into the products because these products you have heard many a times in Malayalam. All my colleagues have done a fantastic job there. I'm just going to connect the dots. link it with the problem. That's it. Okay. So 80% of the problem, 80% of the problem that occurs to the heart comes because of the blood lipid levels. What is lipid? Fat. In simple terms, it is fat. There are two types of fat. One is the stubborn fat, which gets accumulated in the body. The other one is a very flexible fat, which keeps circulating along with the blood. Okay. So both are dangerous. Both are dangerous. And the one that keeps revolving, circulating with your blood is even more dangerous than the fat that gets deposited. Fine. Your triglyceride is one of its kind. Your triglyceride is one of its kind, which keeps circulating with the, the blood. So very dangerous. So here comes one of your customers who says, ma'am, I have a difference in my blood lipid level. You say my triglyceride should be less than 120, my HDL should be less than, beyond 55, and my LDL should be less than 100, and my total cholesterol should be less than 200. But very rarely I see that in my report. And my report for the past 4 or 5 years, I've never shown that. And who's the culprit? The biggest culprit is, the HDL and my total cholesterol and my LDL. And you know something? One variation will lead variation everywhere, because these are all interconnected. Total cholesterol is the combination of all the numbers. But for HDL, it's combination of all the numbers. So that way, one alteration, like how if you get lesser marks in mathematics, your total will also get affected. You cannot expect a great total with lesser marks in mathematics. As good as that. Fine. So when you know these differences are happening, it is important that we target the problem and resolve it. For that, garlic is an amazing supplement. The moment I say garlic, people think, oh, this one, I know I'm using it on a regular basis. Yes, who said no? And none of our curries go without garlic. Okay, I'm taking it on a regular basis. But do you know garlic has a component called allicin? Actually, there's a phytonutrient called allin. And this allin, when combined with oxygen in the air, it gets converted to something called allicin, a very active component in garlic, which helps to maintain the blood lipid levels. Okay. So now if the person is blood lipid level is erratic, not very erratic, but in a normal range in the sense it's in a decent level, and has confidence that it can be brought back, this is the supplement that we have to recommend. And tell them that allicin in garlic, which has the highest yield, 6 mg allicin is present in our garlic. And this is a tablet form. Normally, garlic is given in, soft gel in many companies. We have given it in tablet form. Fine. So you just have to pop in the tablet and drink water, and that will help you to reduce your blood lipid level to a greater extent. So this is allicin. Then some people will say, I don't know whether my heart muscles are working properly. At times I get palpitation. The heart rate is very high. At times the pulse is not very visible. It's very low. Why does this difference happen? And you should understand that this is because of the variation in calcium levels in our body. Oh my goodness. Yeah. Calcium is a very, very important mineral. We think calcium is for bone and teeth. No, it also supports your heart. The contraction and expansion of heart muscle happens with the support of calcium. That's why we have put calcium as PDOC, as the foundation range. So regular intake of calcium can support your heart to function with the same rhythm. Lap, tap, lap, tap, The rhythm should be maintained. It cannot be la, tup, tup, la. No, it cannot be that way. No variation. It should go in a rhythm. So that rhythm can be maintained with our calcium, because we have calcium, magnesium, which also supports the same function. And it's too good. Calcium can be used. The third supplement, one of your customer, see, if you want to know more about calcium, what is it extracted from, where do we get it from, attend our basic sessions. No? So when I talk about the product here, I'm trying to give you the link, how it can support your heart. What is it? What are its features? What are its benefits? You have to attend the basic session. So for any organ related sessions or concept related session, I would request you to equip your knowledge with the basic session. Sir, Parag sir, this is specially for you. The information that I have given about garlic or calcium is not even 5% of the product information, not even 5%. And this session cannot talk about those products in length. I'll waste my time there, because there are other things that has to be discussed within this 1 hour's time. So I'm not getting into those. So you have to attend a Nutrilite basic session to understand the features and benefits of every single product. Okay. So whichever product that comes in, you have to understand the name of the product. Very, very important. Second important thing, people buy product for why, not for what. They don't buy for what, they buy for why. So why it is to be used. That's the second thing that you have to know. Why this product? That's the second thing, the use. Third thing is, what is it made up of? Fourth one is, how do I use it? How many should I take? Fifth one is, any contraindication, that is there anybody there whom should not take this? And then later, maybe, what is the color, what is the shape, how many per tablet in one dabba, can I give it to this people, that people, all that can be later. So these are some basic information which you have to know about your products. Fine. Now coming on to third very important challenge. Somebody says, I was normal till last year, but last year when I went to the doctor says that my diabetic level is very high, and the mild heart attack that I got is because of my diabetic level. There are people. So now what do you suggest? There are supplements, when I talk about supplements, PDOC could be a good choice, definitely a good choice. But PDOC alone cannot control her diabetic. The problem here is diabetic, and the outcome is heart attack. So hit the problem. So Madhunashni would be a great choice. Madhunashni, Shunti and Tuak helps in normal lipid metabolism and glucose metabolism. They support in both. They control your lipid level as well as your glucose level, so that the heart attack can be avoided. So Madhunashni. Somebody would say how much to take, whom to take, at what age, all that is available in product information. Attend that. And then somebody would say, my LDL cholesterol, specifically LDL cholesterol is very high. Low density lipoprotein is very high. Doctors say it shouldn't be so much, but my LDL cholesterol is very high, and this cholesterol goes and stays in the digestive system. They don't even hit the heart, but in the digestive system. So what happens? Digestion doesn't happen properly. When the digestion doesn't happen properly, all the good food that has come to remove the fatty deposits from the heart walls are not coming to the heart wall at all. So there is more, deposits occurring, which causes a problem. So that way, you are supposed to give CH balance. CH stands for cholesterol. Cholesterol balance, which has two important, very, very important ingredient, green tea extract. That's the ingredient in which it is. This green tea is known for having polyphenols. These are chemical names, chemical in the sense, plant components, plant chemicals. They are the chemical names. So don't worry, you will get used to all this for a period of time. And these polyphenols are rich in catechins and theaflavins, which can reduce your LDL level to a greater extent. So somebody says LDL cholesterol is very high. give CH balance. And what will happen if LDL cholesterol and triglyceride is very high? It leads to high BP. You see the connection? Somebody ask them to check their BP and immediately check their lipid level. You will see both are high. Both are interconnected. So the moment, that controls, your BP also reduces. That way you can connect the link. And during the session, you saw some people talking about heart muscle. Abraham sir was talking about heart muscle becoming weak. Yes, there is a very good enzyme called coenzyme, ubiquinone coenzyme Q10, which supports all the muscles to work properly. It supports all the muscles. This is a coenzyme. It is not an enzyme on its own, a coenzyme. When it comes along with the enzyme, it's called coenzyme. So this coenzyme helps in potent antioxidant. It's an antioxidant. It avoids free radical damage. And it helps the cells to produce energy inside the mitochondria. Inside the cell, there is mitochondria. And it helps the cells to produce energy and supply energy to the heart muscle. So that way, heart muscle will eat properly, will get all the energy and can function properly. It doesn't become weak at all. So coenzyme Q10 is an amazing supplement there. Think about heart, think about omega. We cannot forget omega-3 when we think about heart. We all know that. Fine? Yeah. So omega-3, what is omega-3? It's a good fat. Omega-6, even that is a good fat. Then what is bad fat? Your cholesterol, triglyceride, lipid levels, all that is bad fat. So omega-3, omega-6, both are good fat. Fortunately or unfortunately, our body gets good amount of omega-6. Our body gets good amount of omega-6. But getting omega-3 is a challenge. Body doesn't get omega-3 to the extent possible. And omega-3 is of 3 types. EPA, eicosapentaenoic acid, DHA, docosahexaenoic acid, ALA, alpha-linolenic acid. But unfortunately, a body gets good amount of ALA in all the oil, other things that we eat, but EPA and DHA is a big challenge. And not only EPA, DHA, they should be available in certain proportion also. If EPA is 120 mg, DHA should be 160 mg. That proportion should also be maintained. And in today's situation, maintaining that proportion and having omega-3 to that extent is highly not possible. So it's always better to depend on a supplement, and that supplement is salmon omega-3. We get this omega-3 from fish source. The moment I say fish source, many would think liver of fish. No, we have not extracted from the liver of fish, from the fins of fish that we have taken. So it's a very rich form of omega-3, and the proportion of EPA, DHA is very well maintained there, and it supports our heart to a greater extent. So the moment you see cholesterol level high in the lipid profile test, omega-3 should be given as a product. One of your other customer will come and say, I'm said that I might get heart attack in future because of my overweight. Doctor says I'm very heavy. And that can be linked to so many problems. So many, this heaviness or weight, overweight could be because of poor eating habit, poor sleeping habit, no exercise, so many. Diabetic, hypertension, sugar, so many can be linked to that. So we never know to control the problem. Okay, where does it come from? Because see, if a person has, are you diabetic? Yes. Are you with hypertension? Yes. Are you, having high blood pressure, cholesterol and LDL? Yes. How will you know where the weight has come from? You should keep working on everything, but till then you need a product to support. And that product is all plant protein powder. This will not increase the weight, but at the same time, if taken with water, it takes the responsibility of putting you in the same weight or even reducing your weight, because it has a big role to play in our blood cholesterol level, blood pressure level, everything. That's why it is a foundation product, and the richness of isoflavone, soy isoflavone in it, helps to reduce the risk of heart attack also, caused because of diabetic cholesterol and obesity. So protein powder is a great choice. Anybody can take protein powder. For most of the people, obesity is because of food not getting digested properly and stays with a lot of toxins in the body. So for that, cleaning the system, cleaning the gut comes with fiber. And if you check, their diet is with very less fiber, very, very less. And ask them what do they eat? Pizzas, burger, pasta. Not that they are bad. If they are added with good amount of vegetables, they are good. Noodles. 1 portion of noodle, 3 portion of vegetable. Great diet. Who said not to eat? Eat. But what do we do? 3 portion of noodles, 1 portion of vegetable. That is where we make it bad. So that way, fiber as a product reduces cholesterol, helps in gastrointestinal system, and it supports cardiovascular disease to a greater extent, meaning to reduce the cardiovascular disease to a greater extent. Daily, yes, many vitamins, many minerals have a great role to play to control heart disease. Many have, like we saw calcium, right? We saw magnesium. Likewise, many vitamins, many minerals can control heart attack. So don't give the opportunity to the body to say, give you a reason. Body should not give you a reason. Today I didn't have copper. That's why my heartbeat was very low. And sorry, what can I do for that? It should not say. So give a shot of Nutrilite daily to your body on a daily basis to ensure that you get all vitamins and all minerals. 1 tablet a day is sufficient. Then, of course, natural B with yeast. Natural B with yeast. We know our protein, is made up of amino acids. Unfortunately, not all amino acids are used by the body. A body needs amino acid, but not all amino acids are used by the body in one go. There are certain amino acids which are not used by the body for whatever reason it could be. Whatever reason it could be. Say example, I give you 5 sets of alphabet, 5A, 5B, 5C, 5D, 5E, 5 sets of alphabet, and I ask you for 20 words out of them. 20 words. You take these letters and keep forming the words. At the end, after making those 20 words also, you will have few letters pending. Almost all these Z's would be pending, all the Q's would be pending. You will not have a word with Q or Z or, whatever. So those will be pending, and like that, when the amino acids are not used by the body, or whatever has gone for the body has gone and the remaining will be there, they form a group and they are called as homocysteine. And this homocysteine level elevation or greater the homocysteine level in the body will lead to heart attack. So this homocysteine level has to come down. That is taken care by natural B. Fine. So B vitamins support in bringing down the elevated levels of homocysteine to control heart problem. So see how nicely they are linked to heart. And they are so special that your customer comes and talks that this is my problem. You already have a solution there. So henceforth, PDOC is important. I don't say PDOC is not important. Don't restrict with PDOC. I've seen many people, solid customer who comes and says my cholesterol level is very high. So the person doesn't know what to give, getting confused. So I say, take PDOC for 3 months and I will come and see you. 3 months later, there will be some result, but not the drastic result that they are looking at. So what will the customer say? I took your supplements, but I'm not very convinced. And then they'll say 101 reason for not continuing. Now, maybe if this person, our distributor would have said, take CH balance and of course garlic heart health, and then along with PDOC, You see the difference? The customer after 3 months will come and say, my heart is working great because of your supplements. Give me more. So this is how you can become a solution provider, my dear friends. So now that you know these are the specific supplements for specific problems that can happen to the heart. So I would suggest you, along with videos, to go with specific supplementation so that the people, your customers, get better results. Better results would lead them back to you with a lot of references. That's how the business can go. You have come here for business, not for any social service or anything. You can do that, but then business is primary. So do it with a lot of grace, do it with a lot of passion, and do it for a lot of profit. And I'm sure we can all be successful. Fine. So that's from my end. Any questions that you have?